think one of the interesting trends is that the payout among nurse practitioners in these malpractice suits, at least the ones insured by NSO, has been gradually increasing over the years that they studied. So you can see, for example, that in 2012, the average payout for a claim was $285,000. And in 2017, it increased to around 300,000, and in 2022, increased even further to 332,000. Just to give everyone a frame of reference, the average malpractice settlement in the U.S. So this would be a number the National Practitioner Data Bank in 2018 was 348,000. But I think it is interesting that at the rate it's rising. One, I think there may be some point in the near future where it could potentially reach parity with just malpractice claims in general, i.e. including malpractice claims that include physicians. I'm glad that nurse practitioners and non-physician providers in general, hopefully we see this trend, that they are being held responsible for the mistakes they make, just like as a physician would. And I think that is going to be an important principle going forward as we see nurse practitioners be granted independent or full practice authority in more and more states across the nation.
One of the really interesting points in this report were that the highest total average claim among nurse practitioners were those that were covered through a nurse practitioner owned and operated office practice. And in fact, they had the highest dollar amount on average. The report noted that this represented an increase from 8% of claims at the last time they looked at it to 13.8% increase. Clearly, if it's an NP-run practice, there's probably not a physician around, and we are seeing now an increased amount of malpractice claims.
That increase from 8% of claims to 13.8% of claims for these NP offices, I think is keeping track with the number of states that have been granting NPs full practice authority.
Well, I think it's also interesting that the rates are so high and the payouts are so great, and yet actually only a tiny minority of nurse practitioners actually own their own practices. So it's kind of interesting to think, if this is what we're seeing, what is it going to look like for the future? And, in my mind, one can only expect to see these numbers go up.
Yeah, for sure. And if you look at that kind of trend from the big picture, that would indicate that a small proportion of NP-owned or NP-run practices are having a disproportionate impact on malpractice claims, and not in a good way.
Even though the top dollar amount was at NP-run clinics, the number one place that NPs who settled claims were working was actually at a physician office practice, and that was about 31%. So the question is there being proper supervision being done? Is the physician relying on someone to come to them and alert them to concerns? That may be a problem, because if you look at what the claims often had to do with, it was a failure to appropriately refer patients to a higher level of care, either an emergency department or a specialist. And I got to tell you, Kevin, as I was reading through this report, it kind of gave me goosebumps and chills, because you know what? We've all made mistakes. We've all had bad outcomes. And some of the cases that were reported, I thought to myself, this could happen to anyone. These were just really unfortunate situations. But ultimately, what I think separates some of these claims, and one of the reasons why we're seeing an increase in claims on nurse practitioners, other than their increasing numbers, has to do with problems with learning how to correctly diagnose patients. And in fact, the most frequent claim related to incorrect diagnosis and the top injuries were death and cancer. So very serious outcomes. Talk to us about why you think that especially newer nurse practitioners are really struggling with making correct diagnoses for patients.
First and foremost, there are a lot of direct entry nurse practitioner programs do offer programs in which a person with no nursing experience, and as long as they have at least a bachelor's degree, and they can directly progress in the master's level NP course. And of course, that is mostly online with the exception of clinicals. Obviously, compared to a physician, if you've seen any of the diagrams out there, Comparing physician training versus NP training, it's something like 500 to 700 hours versus anywhere from 15,000 hours for a family physician up to who knows how many hours for a neurosurgeon doing 7 years.
They say the increase in claims may be attributed to the overall increase of NPs in the workforce. The data that they looked at, there were about 290,000 nurse practitioners. That was in 2019 or so. But in April of 2022, the AANP reported that the number of NPs in the workforce had increased to 360,000. I mean, it is just an astronomical growth, especially considering that physicians' numbers have remained pretty stagnant at about 1 million. And then they point out that one of the areas to watch is psychiatric mental health, because there's a big increase in NPs filling the role that should or traditionally has been filled by psychiatrists. So one of the things that I did just for fun is I went to the National Practitioner Data Bank, and I put in, you can do this yourself, but you can put in the years and you can select different clinician types. So I put in nurse practitioner, advanced practice nurse, between 2006 and 2022. And you can just see, this is just by malpractice settlements, the number just going up, up, up. And yet, if you put in physicians, MD and DO, the number is trending down, down, down. And that's really interesting. And the same thing, if you put in just adverse action reports, which is if, hospitals have to report something went wrong. It's not necessarily it's a malpractice, but it's an adverse action. Same thing, NPs up, and physicians in this one, they were trending a little bit up, but then in the last couple of years coming down, down, down. Thank you so much, Dr. Kevin Zhang, for joining me to discuss this important topic.
If you'd like to learn more about these topics, please get the books Patients at Risk, The Rise of the Nurse Practitioner and Physician Assistant in Healthcare, and Imposter Doctors, Patients at Risk. If you're a physician and you'd like to learn more about getting involved with advocating for physician-led care and truth and transparency among healthcare practitioners, please join our group, Physicians for Patient Protection.